Hi everybody, welcome to Healthline. I am Gregory Zarian. Can you believe it's near the end of August? Can you believe that summer is come and gone? Have you gone outside? Have you gone hiking, running, swimming? Have you been as active as I invite you to be? Have you gotten off your phone? Have you turned off your computer? And have you done more things with your friends, your family, your pets? And also, have you been paying as much attention as we have for the past year about wearing our mask when needed, washing our hands, having a bit of social distance, and just the more you pay attention to other people, the more they pay attention to you, and the healthier all of us are. So with summer coming to an end, that does not mean that you don't stay outside, you don't get active and healthy and do all the things that we invite you to do. But as we are heading into the fall, and as we are still wanting you to be as healthy as possible, what are you doing? How are you staying healthy? How are you living a healthy lifestyle? Are you doing it by yourself? Are you doing it with your family? Are you doing it with your friends? And are you being preventative about living a healthier, longer life? So our gift to you is Dr. Arthur Babakhanians from Adventist Health Glendale. His specialty is family practice, and he is here to help us hopefully live as long as possible. Welcome, doctor. How are you?
Good. Thanks for having me.
I'm so glad you're here.
Thank you.
First and foremost, why is family practice medicine important to you?
Great question, actually. I'm going to go over why I chose family medicine.
Please.
The main reason I chose family medicine because I'm seeing a wide range of age groups, from pediatric, from adults, from geriatrics, and we see a lot of different stuff, inpatient, outpatient, nursing facilities. So, and our focus mainly is preventative, staying healthy, healthier lifestyle, as you mentioned. That was a great introduction.
Thank you. Being
active, lifestyle, and we're going to go over the lifestyle, what I mean by lifestyle changes and what healthy lifestyle means. It's not, but yeah, the main reason I chose family medicine, that's why.
We're already at our first break, but do most people connect their health to their family, or do most people make their health independent?
Most of the patients that I've seen, they make their health as a connective to the family.
Great.
So it comes from the family. So whatever they've seen throughout the year, especially the younger generations, they take examples, they take role models in their parents, in their siblings. If they're more active, if they're exercising more, they take the same footsteps from their parents or siblings or cousins. I've seen that a lot. And I've seen a lot of my patients that they take initiative to be something different. They've seen too much obesity, medications used, different medical problems, that they want to be different, so they want to be healthier lifestyle, and I always encourage that.
More with Dr. Babakhanians when we come back. Don't go away. Welcome back. The conversation today is all about preventative medicine, preventative lifestyles, a healthy lifestyle, how to take what you know and be an example to your family and your friends. Joining us from Adventist Health Glendale is Dr. Arthur Babakhanians. His specialty is family medicine. Doctor, before we dive into how to stay healthy, what got you into this practice?
My practice, basically, it's me and my partner, Dr. Ara Shafrazian. The main reason we got into this practice to help the community to be healthier, to have healthier lifestyle, healthier options. And the main thing I wanted to emphasize maybe today, education. Some of my patients, they don't know enough. They don't know what are the better options, what should they do, why we recommend certain exercises versus the other one, what are the outcomes of exercises. We'll go over like blood pressure for an example. I mean, all the studies they've done. And weight loss. Exercise, if you do 30 to 45 minutes of aerobic exercises every day.
Minimum 150 minutes a week.
Exactly, and then that's going to decrease your systolic blood pressure, which is the high number, by average like 5 to 7 millimeter mercury, which is significant. And the diastolic is going to come down 3, which is just basic. A little bit of change in your life can make a huge difference.
I love that you said that. And speaking of education, what is your education?
My background, I went to medical school in St. George's Medical School. I did my undergrad at UCLA, My residency and internship and residency I did at Glendale Adventist. I was part of the residency. I was the chief resident, and I graduated from Adventist.
Congratulations.
Thank you.
So it's kind of like welcoming
Giving
you
back
home.
to the community.
Giving back to the community. I was born in this community,
Yeah,
and
perfect.
because I was born here, and years ago, you know, there wasn't that much conversation about health and wellness, and now there is so much of a conversation. But the staggering part about being in this country is we are the most obese country in the world, over 70%. And one thing that you said earlier that I loved is it's all a conversation. So in regards to us as a community and going outside into the community, what is the most important thing we need to know about preventative health and becoming more healthier for ourselves?
One thing I'm going to emphasize, preventative health. By saying preventative health, the whole goal and reason behind that is to prevent becoming ill and having medical problems that can cause issues later on in life. That's the whole point of preventative health. We're going to go over like primary, secondary, tertiary later on, what we mean by primary, secondary,
Let's
tertiary.
do it right now.
Perfect. So primary preventative health, basically it's preventing diseases. That's the primary.
So let's just stop right there. Smoking cigarettes causes cancer.
Causes cancer,
no
causes
question.
COPD, causes
You
lung
know who
issues.
I'm talking to. Because here's the thing, and I say it all the time on this show.
Yeah.
I smoked for over 20 years, 2 packs a day.
And I highly I respect people who stop after smoking so heavily for years.
Thank you. And the truth is, we have something called the computer that if you are looking for someone, hey, I need help, I smoke this, you can find somebody online. You can call
Exactly.
your doctor, you can reach out to me any second of any day.
Yeah, there are options. There are
Perfect.
options. Talk to your physician, go online and ask about possible medication, positive patches, maybe like gums or something to help you.
And
But
also smoking is a disease.
it's a disease.
And people have to realize
Exactly.
that it's a disease.
Exactly. And the main important thing is you have to be ready as a patient. That's the first step. No matter how much I tell my patients, if they're not ready, they're not going to stop.
Sure.
So
You have to want to be here.
You have to want to
My
be.
dad used to say, why would you make something so small be so big?
Exactly.
And when I killed my last cigarette, I was done. And
Exactly.
I've never looked back.
Exactly. There has to be something sparks your interest of smoking. Maybe you have a new son or a child or a grandchild that they don't like.
Or
when
you're just tired of smelling
exactly
horrible,
Yeah.
feeling horrible, and just looking at statistics.
Yeah,
Lung
exactly.
disease, all the cancers possible.
Artery disease, heart disease, coronary artery disease, COPD, exactly, lung disease, cancers. Oh, we see tons and tons of diseases because of smoking. So a small change can make a huge, huge difference.
What are other preventatives?
Preventative,
Go ahead.
preventative, a lot of things. Let's say we come for a complete physical. We do complete physical lab tests, which usually include certain ages are different, but mostly after like 40, we include like lipid panel, cholesterol, make sure your cholesterol is well controlled. We check for diabetes, fairly common in our community. We see a lot of diabetes. It's associated with genetics and obesity that we see. And liver, kidneys, thyroid. Sometimes we've seen thyroid problem. Patients have hard time losing weight, sometimes because they have hypothyroidism, meaning their thyroid is not working as much as it should be. So we see tons of patients with obesity and weight gain problems. The first things we check, we make sure it's not something like thyroid or electrolyte or something like we can fix medically. If not, then we go to a lifestyle. I always ask my patients, what are you doing? What are your lifestyle like? So taking the initiative, talking to them, having a good set plan, following up with them, maybe even monthly or every 3 months, having that. And one thing I emphasize with my patients, don't focus on the number on the scale, because you might be gaining a little muscle, so you might still weigh the same. So there's other like guidelines or measurements. I always like the sizes of your pants or sizes of your dressing. That's a more accurate how you look, how you feel, definitely.
And here's the thing too about, and I love that you said that, is if you focus on the scale, and there's people I know that get on the scale every day, I think it's torture. I haven't been on a scale. I was 30 pounds heavier, and the doctor said, you are 30 pounds heavier, and I said, It's not going to happen ever again. And I changed everything I ate. I changed the way I was working out. And I wanted to be healthier for me. And yes, there was a little bit of vanity in there because I didn't feel great. And because I'm an actor and I model and I'm hosting this show, it wasn't okay for me to be 30 pounds heavier and talk to everybody about, you can drop weight. I had to be an example. I have an idea. Get up, get a glass of water, do 10 jumping jacks, and maybe get some carrots and have an apple. We'll see you on the other side. Don't go away. If you haven't gotten your COVID-19 vaccination yet, slow the spread of this virus by getting vaccinated as soon as you can. Research shows that the vaccination is safe and effective. And as we've been discussing, it's also a conversation that you have with your friends, your family, and people you love. Don't hesitate to see your doctor or seek out medical care. Adventist Health Glendale is safe and ready and open to see you. So don't be afraid to see your doctor and your healthcare professionals at Adventist Health Glendale. Joining us from Adventist Health Glendale is Dr. Arthur Babakhanians, and we're talking about how to keep you as healthy as possible. Doctor, so in the last segment you talked about people going in for screenings and stuff like that. So let me just knock out some topics for men and tell us when they have to get, because it's preventative. Men, how old should a man be before they get their prostate examined?
Prostate, great question. The latest data on the guidelines of back in the day, after age of 50, whenever you were going to a primary care physician, they would always do a digital rectal exam. Now the guidelines, they're leaning more against it.
Okay.
And although we test the PSA, which is in the blood, they recommend against the rectal exam because there was so many false positives, and you go into invasive possible testings and stuff.
Sure.
So nowadays, unless you have symptoms, which is you get up multiple times at night for urination, or you have trouble with the streaming, or your urination is not adequate, then those are the indication to check it. If no symptoms, no issues, and no family history of prostate cancer, we just check the PSA, which is a good indicator. If usually elevated, then we go the further step, possibly the rectal exam.
And one thing you said too about families, talk to your parents, talk to your mom and your
Exactly.
dad and your grandparents about family history of cancer, prostate cancer, all of it. And also another sign and symptom for men that something could be wrong is the inability to keep a consecutive erection. Here's the thing, more men get sick because they don't talk about it. Talk about it to your wife, to your partner, to your doctor. It's time to let the ego go and say, hey, this is happening. And I say this often on the show. If you are in a relationship or you are with someone that you feel completely safe with, have them look at your body. Hey, can you look at the back of my back, my legs, my feet, and do the same in return, because you will possibly see something that we cannot or they cannot. We want to keep you here as long as possible. I want to be here as long as possible. It's just saying, hey, can you check me out? Can I check you out?
Perfect, yeah.
With women and self-examinations for breast cancer and all that, what is the age on that?
Self-examination, I would say 40.
Okay.
40 is the age that we start mammograms too, just to checking. If there's family history, younger ages, then we start a little younger. And since you're on the topic of the female, pap smears are very, very important. We start at
what
21.
age?
21.
21, okay.
21. And I always tell my patients, regardless of sexual activity, being sexual, how many partners, the guideline is 21, you start doing the pap smears.
And here's the thing about sex, is have a conversation with your doctor, with your parents. HPV is huge.
Huge.
And also, as everyone was so afraid of HIV and, unplanned pregnancy, there are so many sexual diseases that people can get.
There are
Your body, you get to say no, and if you choose to do something, have a conversation with your partner. It's a conversation. A conversation will save your life, and too many people do not make it or get sick because they were too afraid of what somebody else thought.
Exactly.
We also, so I hate to say here too, in regards to self-exams, is for women, when you do a self-exam, we had a doctor here, a breast cancer doctor, lay on the floor because the breast falls sideways, and just check from here and see if there's anything that is different, color, shape, size, discoloration. And same thing with men. 1 out of every 100 new diagnoses, 1 to 3 are men with breast cancer.
Exactly.
So it's also having a conversation.
Exactly. And one more thing I'm going to add, I'm sure I think Dr. Holmes was here and he mentioned it. Check for lymph nodes too,
Absolutely.
underarm lymph nodes, around the neck lymph nodes. If you notice any swelling, any enlargement, tell your doctor, go over to your doctor and ask, I have a concern. It's fairly easily diagnosed and fairly easily followed up, but don't be afraid to talk to your physician or family. That's the main reason.
As we were talking about when you said Narine Oratunian, she's our family doctor and she saved my life from the smoking, is I tell her everything. And being a male and she's a female, she looks at me and she goes, what? And I go, well, you know, I'm embarrassed. And she goes, embarrassed about what?
Yeah.
Doctors don't get embarrassed. It's not the first time they've heard what we're concerned about. Doctor, talk to us about, first of all, how this community, older generations, aren't as active and healthy as we are now.
Yeah.
How do you invite the older generation to get up and get out? Because you just don't wake up obese. It's because you sit on your couch and you don't get as much activity.
Yeah, and I think the main reason, and one of the main reasons that I've seen they become very, very, like, they're not active because they haven't done it for so many years.
Sure.
So they get into this like cycle of not doing it, and then they get iller, they get knee pain, joint pain, and it's harder for them to walk. So continuously starting at age like 50, start being more active, have a plan, exercise, go to a pool, aqua therapy I like. If you have joint pain, if you have back pain, water is your best friend. And families, they have to push the elders to be more active.
And here's the thing, as you said, we are all taught. My parents had us get up and get out.
Exactly.
My older brother Vincent has 2 boys. They get up and they get out. You do it as a family. I have other friends that the entire family's obese.
Exactly.
Because they watch mom and dad, and then the children are suffering, the parents are suffering. They're like, how did this happen? You know how it happened.
Yeah, they have to break the cycle.
That it is, and it's about, we had a great girl on here named Melissa Lands once. She wrote a book called The Fresh 20 about 20 ingredients that you create as a family. Go back to cooking dinner with your kids, doing it in your relationship and doing it together so you can share with your partner and your loved ones because it takes as long to make a healthy dinner as it does to go to the drive-thru, look at the menu, and I'm not saying that everything is bad on a drive-thru, but it's healthier to do it at home because then you also got to put your phones down and talk and be a fan.
An experience. Yeah.
It's an experience. When we come back, I'm going to ask you about diets and fads and also the importance of the Fitbit and the Apple Watch and how we can check into our own health. More Dr. Babakhanians when we come back. Don't go away. Welcome back. Did you know that Adventist Health Glendale has received a 5-star rating from CMS, 13 consecutive A ratings for patient safety from the Leapfrog Group, and ranked one of the best hospitals in California by U.S. News and World Report? To find a local physician that you can have an open and honest conversation, please visit adventisthealth.org/doctor. Joining us from Adventist Health Glendale is family practice superstar, Dr. Arthur Babakhanians. Doctor, when we were heading out, I acknowledged the Fitbit, the Apple Watch, and all these tech devices that are here to help us be healthy. What are your thoughts on these, and how much do you invite all of us to get involved more?
I highly recommend them. I think it's another reason and it's another source of motivation for you to get up. I have friends that they have their own alarm that they have to get up. It's time for me to get up, take some steps, how many steps I've had during the day, how many calories I've burned. You can monitor your heart rate. Every person, based on their age, they have a heart rate that it's fat burning zone. I always recommend it to my patients when they're doing exercises and cardio to be in the fat burning zone. That's going to help you the most. So I highly recommend them. Get off your iPhone and iPad and
I thought
get
you were
on your
going to say get off your butt.
No.
Get off your butt.
Yeah.
But it's true.
Exactly.
And, you know, so many people are afraid to get up and get out. Well, I'm not going to get up and run 2 miles a day. No one asked you to do that. What you do is if you get up and you walk out the front door and just say you want to walk. I have a friend, she was 50 pounds overweight, and she said, I just put on this weight and I don't know what to do. And I said, I'm tired of hearing it.
Yeah.
And she said, wow, that's rough. And I said, well, no, I love you. She goes, what do I do? And I said, you walk from here to the block and back.
Exactly.
She goes, is that it? And I said, yes. And then I said, within a week, walk 2 blocks. She dropped over 50 pounds, and she's the healthiest she's been, because so many people are afraid to just get up and take a baby step. No one's saying you have to do it all in one day. We're just inviting you to slowly do it, because then it becomes part of your lifestyle.
And it's baby steps. You're absolutely right. I tell the patients, when you go to a grocery shop, park farther away and walk back and forth.
Climb the stairs.
Exactly. Or when you go to the gym, don't park and take the elevator. Take the stairs. You're going to the gym. I see so many people and taking the elevators.
And when you go to the gym, leave your phone in the car. What do you do? And here's the thing. They give you machines that you can watch TV on. Just bring your AirPods. Don't bring your phone. That's just ridiculous. There is so much talk about the keto diet, eating for your blood type, fasting, vegetarian. How do we know what is best for us?
The thing that I recommend, whatever you can sustain for a long run, that's the one that I recommend. Each patient is different. My partner himself has been doing fasting. It has been working for him. I have patients that they're on keto diet and worked great for them. Some of my patients are vegan, vegetarian, and I advise like take these vitamins because you might not be getting from vegetarian sources.
So then you support supplements as well?
I support supplements. I don't support like good supplements that they're like data behind them and stuff. But whatever you can sustain. I personally like low carbohydrates and high protein diet. That's my favorite personally.
So it's more like the Mediterranean?
Exactly, Mediterranean.
More green.
Which has shown to be effective for dementia, preventing dementia and Alzheimer's, actually, Mediterranean diet.
And also lots of olive oil.
Olive oil, yes, yes. So whatever you can sustain for a long run, that's the main thing. And sustain, and if you lose the weight, that's going to help everything.
In regards to supplements, do you believe that people should just go out and take things, or is it a conversation that somebody needs to have with their family doctor?
I think it's a conversation you should have with your family doctor, because some of the supplements can cause adverse reactions, and if you have liver problem or kidney problems, then definitely discuss it with your family medicine doctor first.
In regards to sleep, a lot of people, especially now with where we are in the world, aren't getting enough sleep. What are your thoughts about finding and maintaining proper sleep?
Sleep is one of the most important things that I've seen people not getting enough of. I have a lot of patients, they come in, they ask, I'm chronically fatigued. I ask them how much sleep you get, they like 3 hours, 4 hours. And I ask them, you expect to be like not fatigued, because 3 hours, 4 hours is not enough. So exercise on that aspect will help. Your body will get tired, you're going to get better sleep, definitely. And one thing I'm going to connect with the whole thing, because we've been talking about the body, the mind health, it's very important. I've been seeing a lot of anxiety, depression, stress, because once you're not feeling good about yourself, your image, or you feel unhealthy, or you don't like the way you're looking, then it could cause stress, anxiety, depression, which you're overeating after those, and then you get into this cycle. So it's all hand in hand.
And I love that you said also the whole thing about mental. We are in this big conversation now that it's okay to talk about mental health. We did a great show, and I made sure that we talked about if you or someone you love is considering suicide. You know, it's a conversation that is now more open.
And as far as preventative health that we discussed during the last segment, we have like questionnaire we ask during the physicals. There's like CG cap that we ask, any suicide ideation, how's your mood, how's your sleep, how's your appetite. So we follow up. It has to be addressed by your family medicine doctor, and don't be afraid to talk about it.
And in regards to a lot of people that are suffering from addictions, reach out. Adventist Health has a great mental health unit that I'm very connected to, and they had GADS.
I work with GADS a lot.
GADS, I was Glendale Adventist Alcohol and Drug Services that I was very supportive of. You can find support and resources online. What are your final thoughts, Doc, on creating and then maintaining a healthy lifestyle?
It's all baby steps. It's all step by step, A, B, C, and then after a year, after 6 months, you'll feel the difference, and then you're going to keep going and going. So focus on yourself and spread the lifestyle to the others, your wife, your partner, your kids. So let's establish a healthy lifestyle as a community and be healthier.
Thank you so much for being here.
Thank
So
you.
you heard it from Dr. Babakhanians. Promote a healthy lifestyle to the ones that you love. Start with yourself, then do it with your mom and your dad, your partner, your husband, your wife, your friends, your neighbors. And the more active and the more changes people see, they're going to be like, hey, what are you doing? What is that? Being healthy shouldn't be a chore. It's a gift, because the alternative isn't so great. Remember, the most important conversation you're going to have is about you and your health. So why not start talking about it now with your family and friends? You can find us on all types of social media, YouTube at Adventist Health Glendale, and you can follow us on Facebook at AH Glendale, and I am at Gregory Zarian. Take care, be healthy, say thank you and please. We'll see you next time.